Working in healthcare, I can recognize that medicine has the potential to save lives. I also recognize that it has the ability to take a person with a disease and give them an entirely new life. I can also see that individuals can get hope and a second chance at life with the use of medicine. Medicine does have the power to do good, but it also has the power to do bad at the same time. It does have the potential to give positive outcomes just as much as it can give negative outcomes. It can be a blessing and a curse. If medications are taken incorrectly, it has a capability to take over and potentially destroy many lives. Specifically today, I will be talking about the abuse and misuse of opioids that have now become a global issue for millions of people around the world. Today, I will be talking about how opioids originated, along with their history. I'm going to be including statistics on the prevalence of opioid abuse around the world. I'm also going to explore how this crisis has greatly affected numerous areas of society, including healthcare, the legal system, minority groups, nursing, law enforcement, and our educational system. I'm also going to talk about interventions that have already been put in place to give hope to those suffering with addiction and help numbers begin to decline. I'll also talk about interventions that I think we should put in place that could potentially help this issue as well. Going back in time, opioids derived from the opium poppy plant. It was first extracted by German pharmacists in the 1800s. This was later used to inject morphine into patients, and this was used during minor procedures to provide pain relief. It was discovered that if this drug was taken in high amounts, it can give the users a sense of euphoria or a high. Beyond just that, it can also give its users sedation, decreased gastric motility, respiratory depression, dizziness, hypotension, bradycardia, and even death. Individuals that misuse opioids over an extended period of time can also begin to develop a tolerance. This tolerance would cause them to need higher dosages of the drug to reach their euphoric high that they usually get, and this could damage their organs and even cause organ failure. Opioids started to become prevalent in the US in the 1860s in the form of morphine. It was given to soldiers who were wounded in war. These soldiers would eventually become dependent and addicted to these drugs and the high that it would give them. Fast forward to today, the problem has only gotten worse. It now affects the lives of many people and their families. According to the U.S. Department of Health and Human Services, it has been estimated that 10.1 million individuals 12 and up have misused opioids in 2019. In 2017 of October, they declared opioid abuse a public health emergency. They also reported that in 2018, 2 out of 3 drug overdoses involved the use of opioids. Not only was it a problem, but it continues to be a problem that is only worsening. The U.S. Department of Health and Human Services have discovered that opioid abuse-related emergency admissions rose 30% in the U.S. from July 2016 to September 2017. Beyond just being an issue in the United States, it is now an issue globally. When you look at United States, roughly 1 million people have died from an overdose since 1999, and more than half of these deaths occurred after 2016. There's also a low amount of people that receive treatment for their addiction in the United States. There was a study that showed fewer than 22% of patients who abuse opioids have sought out treatment between 2009 and 2013. If you compare this statistic to places other than the US, if you look at Switzerland, roughly 71 to 88% sought out treatment for their disorder in 2016. With the opioid crisis still an issue in Europe, it is not as bad as it is in the United States. It was found in a study that opioid-related deaths in Europe were 1.3 per 100,000 people. If you compare this number to the United States, the mortality rate was 14.9 per 100,000 people. Opioid use is also common in Asia. The country that holds the highest prevalence of use is in Afghanistan. In fact, over half of the world's opioid misuse occurs in Afghanistan. Looking at America a little bit closer, the opioid crisis has also affected America's healthcare system as a whole. Following rules and guidelines when prescribing these kinds of drugs is extremely important for physicians to follow. Even when they follow all these rules, there can still be a loophole in our healthcare system that gets these patients at risk for opioid abuse. After opioids are prescribed to patients, these patients can give their prescription opioids to individuals who do not have a prescription. This is something hard for our system to be able to control. There's no telling which hands that these drugs can fall into. Also, due to the rising incidence of opioid misuse and mortality rates, physicians may feel hesitant to prescribe opioids to patients for fear of misuse. They can also fear an investigation from the state board or federal agencies. This may even cause undertreatment of patients. So patients are not being treated for the pain that they're experiencing, and this could ultimately lead to worsening of certain conditions for patients. Beyond the healthcare system, if we dive a little bit deeper into how the opioid crisis affects America, staff members such as nurses, social workers, therapists, nutritionists, case managers, and pharmacists are also affected. The American Nurses Association believes that nurses play a huge role in lowering the incidence of opioid misuse and overdose. There also are some barriers to keep us from doing this. Health professionals may feel as though they are immune to drug abuse, but that's simply not the case. They are just as in much danger as the patients that they treat. In fact, it is not uncommon for physicians to self-medicate as well. Specialties such as emergency medicine, psychiatry, anesthetics, and nurses in high-stress specialties are at higher risk for misusing opioids themselves. Frequent contact and access to these drugs, along with stress, play a huge role in increasing the risk for addiction for these workers. 1.3 million working nurses in the United States that were taken as participants in a study. It was estimated that 8% of them experienced substance use disorders. Opioids were the most frequently abused drugs within this demographic of patients. Nurses would obtain these drugs directly from their patients during care by diverting them. There was easy access to these drugs from nurses, so they were definitely at risk for opioid abuse. Beyond just the healthcare system, child welfare has also been affected by this crisis. Opioid use during pregnancy increases the risk of infant mortality and disability. Infants born from mothers who abuse opioids during pregnancy can result in the baby being born with neonatal abstinence syndrome. This is where the infant goes through a dangerous period of withdrawal and can ultimately lead to infant death. Opioid crisis in America also does not discriminate. Minority groups are greatly affected by this issue. A study was conducted between March 2018 and August 2021 that observed opioid death rates among minority groups in America. It was found that the overall highest rates were within the non-Hispanic Black or African American men and American Indian or Alaskan Native men. Older adults are also victims to this opioid crisis. As people age, they experience painful health conditions, which can be a normal thing. This can put them at risk of misusing the opioids that they are prescribed by their doctor to manage this pain that they're experiencing. Law enforcement is also affected by this crisis. Many law enforcement officers carry a life-saving opioid reversing drug called naloxone, which is a drug that is given via nasal spray that works as an opioid antagonist. As soon as they arrive on scene, police officers are able to act quickly, intervene quickly, and save the life of the patient. Many law enforcement agencies around the United States are launching this reversal program in an attempt to lower the rate of opioid-related deaths. In fact, 2,300 law enforcement agencies across 42 states now have a program in place as of the year 2018 that include the use of naloxone as a opioid reversal agent. The legal system also is affected by the opioid crisis. There have been numerous studies related to the involvement of the legal system with opioid use in veteran population, which interests me a lot. This study that I read about talked about how that veterans with a criminal history had a higher opioid mortality rate compared to those who had not had any legal involvement. The education system is also affected by this crisis. For example, the Ohio Department of Education has stated that a law has been passed in the state that included adding opioid abuse prevention into their health education curriculums. It's important that we help prepare the next generation to help fight the war against opioids in America. Nurses and other healthcare workers are at the front line of battle against opioid abuse. As I spoke about previously, there are barriers to providing care to this population. There have been numerous studies that involved asking nurse participants about what they think barriers are to providing care to these patients, and many of them reported that stigma and biases towards patients with addiction can alter the care that they give. It's very important to treat and give every single patient the same respect as any other patient. You need to support these patients during such a sensitive period of their life. It is also important to not assume that a patient is drug seeking. Doing so can make the nurse less likely to want to give an opioid pain medication to the patient and thus failing to control the patient's pain. Next, I will speak about the interventions that are in place to help lower the numbers of opioid abuse and mortality. The first ones I'll be talking about are the ones on the federal level. During his term, President Obama released ways that America can continue this war. Federal departments have now been told to work directly with healthcare professionals in the means of educating physicians. During their education, they should instruct and provide critical teaching to providers on how to safely prescribe medications to patients. And also they need to ensure that physicians are prescribing these medications appropriately and in the right context. Another way is he did ask for insurance agencies to identify possible barriers to providing treatment for these patients. When I think about my personal experience and what I do in my personal practice to help with the opioid crisis, whenever I get an admission on my floor, I will ask them questions to get a better look on the condition of the patient. I'll ask them if they take any illicit or unprescribed drugs. Regarding my questions, they could score for a social work consult. This could be a turning point in the patient's life, and it's very important to ask all the questions to the patient, make them feel comfortable with talking to you. That way you're able to help them. During my time as a nurse, I always thought that opioid abuse was not very common among older adults. So when I did ask older adults if they had any drug abuse history, I would always expect the answer to be no. But after doing my studies, I realized that is not the case, and it can really be anybody. At my place of work now, all my patients have PRN orders of naloxone if they are taking opioids as part of their pain regimen. This is a great way to combat accidental opioid overdose. I've also been trained on how to correctly identify the warning signs and symptoms of opioid overdose and how to correctly administer naloxone. I always educate my patients on the signs and symptoms of overdose and the risk of addiction when taking these drugs. I educate my patients on keeping them out of reach of children and do not give any prescribed medications to anybody that they're not prescribed for. I collaborate with social work and physicians and therapists in providing care for these patients. I stay empathetic and supportive during this period as well. Overall, the opioid crisis affects our healthcare system, healthcare providers, legal systems, social services, education systems, and welfare systems across the United States. It also specifically affects the nursing profession as a whole. Interventions have been and should continue to be put in place around the world to put an end to this nightmare. We need to support our citizens and healthcare providers in hopes that one day we can finally see the light at the end of the tunnel.